Thank you so much, Jan, and welcome to everyone to this webinar on health sector engagement on climate and health, and looking at what we can learn from others and what we can learn together to really strengthen health sector engagement. As Anne mentioned, I am the Executive Director of the Global Climate and Health Alliance, which is a global alliance of health organizations that are committed to advocating for and addressing climate change. They've come together to elevate a joint health voice on this issue. You know, we've seen from the global pandemic the kind of impact that a health crisis can have on the world. And what those of us from the health community advocating on climate change recognize is that if we don't address climate change, we will see more and more of these kinds of health crises. So the meeting today to really strengthen that health voice and drive engagement from the health sector to elevate this issue is really important. And health professionals and the health sector are really uniquely positioned to carry that message. We have one change in our speaker lineup today. Unfortunately, Professor Michael Kazanowski will not be able to join us as a speaker, although I understand that he may join us as a participant for at least part of the day. So this is a reminder for anybody who may have just joined that we invite you to type questions in via the Q&A, and to do so as we go along. Feel free to add them at any point that you have a question in mind. And then as a reminder again for anyone who just joined us, there is simultaneous translation available. To access the translation, go to the translation icon at the bottom of your screen and type in and select English if you want translation into English, and select Portuguese if you want translation into Polish. Now with this, I'm going to introduce our first speaker. We have the great pleasure of having with us today Dr. Marija Neira of the World Health Organization. Dr. Neira is the director of the Department of Public Health, Environment, and Social Determinants. And WHO has really been at the forefront of raising awareness on the health impacts of climate change, starting from an initial report back in 2008, and with long-standing engagement at the UN. The Global Climate and Health Alliance has been honored to collaborate with WHO and the climate team there on events alongside the UN climate negotiations and at many other opportunities. And more recently, WHO has strengthened its commitment to collaborating with health civil society through the formation of a civil society working group on climate and health. So Dr. Neira will share with us her perspective on health engagement on climate change, both the challenges and the opportunities that presents. Over to you, Marija.
Thank you, Jeni, and such a pleasure to be with you personally and with all the participants today, and with HEAL in general. You have been really an incredible partner and an incredible advocate. And now in these strange and extraordinary times that we are all confronting, more than ever, we need associations, groups, networks as powerful and as committed as yours, and the ones that are contributing today and participating and engaged on doing something. We have been on the middle of this pandemic crisis or earthquake, or as you want to call it, catastrophe, or a strange situation for almost 8 months now, or almost 9 months. And things that we never thought it would be able to happen are happening. We saw the planet completely stop, business paralyzed, citizens staying at home, and all of that in the name of health. And it's true that we never wanted anything like that, anything so dramatic. And the public health community, we will do every day anything it will take to prevent one death. But unfortunately, we cannot go for such an extreme measures, but it's time to make sure that people understand that if we don't want to reach such a terrible situation with extreme measures, we need to start to change our culture and thinking a little bit more on prevention, primary prevention culture and investments that will go into that direction. Jeni was mentioning the reports that WHO has been doing on climate change and health, the impacts that the environment will have on our health. But I was looking at the air quality reports by WHO, and in fact, we have one in 1958 talking already about how the bad quality of air that the people were breathing in London was affecting their health. So, you know, the fight for preventing and creating better conditions for the health of the people has started a long time ago. So I think it's time now to collectively having some brainstorming and thinking how we can use our knowledge, our network, and our capacity to making sure that we are not missing the opportunity of the recovery that is starting now. The question here that is that a recovery is starting. The governments cannot afford to go for another lockdown. The economies needs to recover. And we need to make sure that this recovery will be a healthy and green one. So in that sense, the global health community, we have an incredibly high responsibility. So it's not just our commitment, our engagement, our passion. Now it is a responsibility. We need to make sure that we will not make the mistakes we have been making for a long time. I think if we can summarize very quickly some of the things that we saw during the pandemic, we saw that you need a universal health coverage. Those countries without a good and strong universal health coverage were suffering more than others. You need an epidemic preparedness and response plan. Of course, you need a good and strong epidemiological surveillance system to tell you that an epidemic or an infectious agent with an epidemic potential is coming. You need a very well-trained health professional group. You need to invest on them. You need to realize that science and research is not something that is on television these days. The scientists are becoming stars on television suddenly, and while for many years most of those famous researchers today, they have been surviving on very basic little money for pursuing their research without any attention from politicians or anyone. Now everybody, I hope, will realize that we need to invest in science and research and on health professionals because we desperately need it. We have learned as well that the air we breathe, it can be better than the one we are used to. That it's not nice to live on a city which is polluted. It's not nice to live on a city which is have a lot of noise and traffic. And the fact that during the lockdown we realized that it can be different, maybe it tells us a good lesson. The same for we are not anymore ready to spend 2-3 hours a day on a car, going to our working station and coming back on a very heavy. Maybe we would like to go back to the rural areas and start to make sure that in the rural areas we have better conditions to have proper life, and our cities needs to become different, more humans, more adaptable to our needs, and not places where our health is very much at risk. But we learn as well a lot of social lessons. We realize that we have inequities, enormous ones. We knew it, but now we were really confronted to that. And we realize that there is some solidarity as well. So even in those difficult situations, people have demonstrated that they can be very solidar. We learn as well that you need a strong leadership at national level, at regional level, at global level, on a global health architecture. We need a strong leadership as well, somebody who will coordinate, make consistency and coherence and avoiding duplication. And now on the third part, they need us on the recovery. They need us desperately because probably because we are health professionals, we understand that when you do a diagnosis of one disease, you need as well to consider what has been causing that disease. We have been saying for many years that environmental risk factors are responsible for more than 25% of the global burden of disease. So it's not lack of awareness on that. We have been saying that we need better food systems and more sustainable ones. We have been saying, and that's probably not enough, that fossil fuels are killing us. So if your lungs are exposed every day to a very polluted city, it's not a coincidence that those living in those very polluted cities will have higher risk of they will have an increased risk of being affected by an infectious respiratory virus or bacteria, because you will be much more vulnerable. So people realize all of that, and now we need to make sure that they will hear us on this recovery, and they will be following our prescriptions. Those prescriptions are very nice and very normal, very pragmatic, nothing absolutely, not even provocative. The first one is, recover your relationship with nature, with ecosystems, stop destroying it, stop eating animals, wildlife animals, and then, putting a stress on the environment. Deforestation and intensive agricultural practices, very pollutant ones. Provide exit services. Stop saying to people, wash your hands, and then you don't have the capacity to provide them with the minimum facilities for washing their hands or having a minimum of sanitation. The third one, this transition to a healthy, green, sustainable, renewable, modern source of energy, whatever you want to call it, but we need to do this transition, and I hope the level of ambition of that one will be very, very high, but we need to move to renewable or sustainable sources, clean sources of energy, because this is not sustainable for anyone. We need to look at our cities, and again, I think we might look at the new generations, the young ones that they are having small children, they might see more advantages of growing their children outside the city, which is very polluted and very crowded, and creating the best conditions. I hope the governments will use part of those stimulus packages to create those conditions and facilitate their life. And something that we have been saying for many years now, and on a very strong voice, I hope at least, is that we need to stop giving subsidies to fossil fuels. I mean, this is so basic. And we need to be very consistent, very pragmatic. We need to move on those prescriptions very quickly, because the decisions by politicians on how to invest that money are coming. And unfortunately, we still have governments where they think that they need to invest on fossil fuels at the risk of not having a labor force or work or affecting negatively the economy. This is an argument that we are not buying at all. So we need to prepare our own troops to make sure that they will react to that argument and contradict it and move on a more healthy one. So with all of that, I think if we are convinced, we can get our clinicians out of the hospitals and getting and making sure that their voice is very strong and as respected and credible as it used to be. And we need to be present in all the fora, in all the discussions, and be very pragmatic as the health professionals can be. I saw many initiatives now going in different directions, looking at how COVID is affecting this, how COVID is affecting that, and there is a proliferation now on analysis on how COVID is affecting everything. We know that COVID is affecting everything, and it's dramatic. People will lose their jobs. People will have a horrible economic situation for years now. So one extra reason why as health professionals, we need to contribute to offer solutions. I think it's, as I say, not just a commitment or a moral engagement. I think it now is even a responsibility for us to be the real public health officers, the real humanists, I mean, having the whole context approach, and only maybe health professionals can do it, and helping politicians to take the right decisions. I think this recovery has already started. It depends very much of us, whether it's a healthy and green recovery or just a quick, dirty economic recovery. So I'm sure that we all want to be part of that, and we will be protagonists of this healthy recovery. Thank you for your attention, and over to you, back to you. Thanks.
Thank you so much, Marija. And you really have made a very compelling case for the ways in which health is really at stake in everything we're talking about here today, and also that the health community has a real responsibility. Just one follow-up question. When you think about health professionals becoming engaged as these champions that you're talking about, and as these spokesperson to really carry this message, what do you think is needed from your perspective to most help that engagement, to more deeply engage our peers? We know that there are strong champions already, but there are many health professionals that have not yet taken this up. So what would be your one highest recommendation?
I think, thanks, Jeni. This is obviously the key question. I think some of them, or many of them, are already kind of reacting, and of course they feel part of this terrible situation in which the society is now trying to confront. So I think this has changed a little bit the way of some clinicians, for instance, were engaged. I think we have a responsibility to provide very clear messages and recommendations, because not all the doctors are at the same level of knowledge and in terms of environmental issues, and some of them are still confused about being environmentally planned, and very confused science that they don't, they think they are not very well aware of, so they feel a little bit uncomfortable. So simplifying the message, unifying that message. This is the diagnosis. Those are the prescription, and this is the treatment. Let's unify all of us and ask on a very strong way for all of this. I was telling the other day at the Indian Doctors for Clean Air, I was telling that, if we want to start a revolution, first you need a cause, a mission, and we have it. Come on, we have a huge one. You need to have then an army of people convinced of that, and you need to provide them with, you need to provide this speech that will inflammate all your troops and go for that. And I think this is exactly the key messages needs to be very clear, consistent, and even repeating them ad nauseam for everybody to align around that, and then starting the campaign and the revolution. The white revolution has to start to become green.
Thanks so much. And on that theme of clear key messages, I don't think you mentioned, but WHO has a fantastic manifesto about a healthy recovery. So that would be a great place to start, that makes the connection between recovering from COVID and the future that we have to build to protect people's health.
Yeah, the reason why we did the manifesto was exactly that. First, the word manifesto is very clear. And then we put the 6 prescriptions that I described already on the transition to a healthy urban planning, a healthy energy transition, a healthy food consumption, production and consumption, basic services, better relationship with nature, and stop the fossil fuels. So those prescriptions are very clear. And then we have what we call the actionables, which are 80 and are very clear indicators that are linked, and most of them to the SDGs. And I think it gives simplifies a little bit the message and allow everyone from different groups to align with that, because it's nothing new. It's just summarizing on a very prescriptive way what we think it will contribute to this movement and revolution. Thank you.
Well, thank you so much for your remarks and for WHO's continued leadership in this area. It's really extraordinary and extremely helpful to guide the rest of us in this work. Okay, now we're going to have the pleasure of hearing from our next speaker, Professor Marija Jevtic, excuse me. Professor Jevtic is the chair of the section on environment and health of the European Public Health Association, which is an association for public health associations and institutes from across Europe. It brings together 79 members from 47 countries, so a powerful institution. Professor Jevtic is full professor at the University of Novi Sad on the medical faculty and is a specialist in hygiene at the Institute of Public Health in Vojvodina. She'll speak about the European Public Health Association's upcoming statement on environment, climate, and health, and the lessons that are being learned from engagement in Serbia. So over to you, Professor Jevtic.
Thank you. Dear colleagues and friends, I would like to thank, first of all, for the invitation on this HIL webinar. And it was my pleasure to talk about health sector engagement on climate and health, and to discuss what can we learn from others and what can we do together. I also would like to congratulate to our Polish colleagues to their great efforts to put this important topic in the focus of citizens and experts' interest in Poland. And also I would like to thank Marija Neira for excellent speech. It is not easy to speak about after her. So climate change, I would like to share my presentation, if I can get permission. Thank you. Climate change is a challenge for public health, health systems, and therefore for us health professionals. Each of us in our professional and private life recognize the impact of climate change on a daily basis. The possibilities for the operation of health professionals are reflected in strengthening of their own capacities in human resources and their planning, participation in local and national public health policies and environmental protection, cooperation, for example, with the urban planners in order to provide various benefits by taking the lead role in reducing harmful emissions in all areas, but especially in health sector. The climate change factory in its full capacities produces direct and indirect climate change byproducts. It is well known. So we should think in sustainable development goals way and change our mindset, not only mindset of health professionals, clinicians, citizens, and future generations, children primarily. Our environmental health section of European Public Health Association is very active to promote, advocate, discuss, and support all researchers and members in climate health field. Our priorities are climate and health issues together with SDGs and air pollution and energy issues as part of that. Climate change is not only health issues and issues of the industrial sector, but also it's very big educational issue and challenges. Important part of the solution is a transformative process of education through a lifestyle, which would produce corresponding changes in the mindset of the population, citizens, and children, and also vulnerable groups and everything for vulnerable groups. To achieving these goals, we should change and improve our curricula in medical faculties, for example, but also in all educational steps in different areas. And something else, it's very important, not to change curricula, not only change curricula, but changing legislation in our countries to move step forward to better results in saving our environment. This is one example how we can make useful action in academia in a university area. In December, European School of Sustainability, Science and Research planning to organize World Sustainable Development Teaching Day, and all experts and teachers are invited to adopt a sustainable development presentation and include in teaching lessons. This is very important for all of us, especially for medical faculties, because I think that our faculties is more clinical oriented, not prevention oriented faculties. But I also want to mention, I would like to mention International Society for the Psychoanalytic Study of Organization. This is one totally different organization, but also dedicated to climate change issues. They are established a climate commission with the aim to change mindset of organization in that area. I'm coming from Serbia. It is a small country in Western Balkan area in Europe. We are a candidate country, not a part of EU countries, but I think that we have a lot of actions, but not enough actions, like in the other countries, in advocacy, research and practice experience. And I would like to mention one event last year when we merge experts with decision makers in science mid-parliaments. And we talked about a very interesting and important topic for us: renewable sources of energy, climate changes, and water supply, and of course, air quality and greenhouse gases. Serbia, as a small country, is a part of Western Balkan countries, and climate and health issues is wider than our borders. So environmental challenges are common, and we should work, act, and research together. Experts in public health sector and in other sectors are very aware that working together is the only way to a sustainable future. We need to undertake a holistic approach on climate and health issues to achieve a sustainable future for new generations, for our children and their children. It is very important to improve knowledge of all health professionals in primordial prevention, and to improve cooperation with other experts, but also better cooperation among clinicians and public health professionals. because we are minority in health sector, public health health professionals are just 3% of all the other human resources in health sector. This is my personal professional challenge to make continuum education in that area, like climate, air pollution, energy, and health, and the role of all health professionals to motivate young PhD students in environmental health research area, and to talk through different kind of media with citizens to increase their awareness in the area of climate change. Global climate agreements, sustainable development goals, and the adopted EU Green Deal should be guiding principle and policy pathways for all the experts and the society as large. Key principles from those documents should provide additional arguments for research, advocacy, and other type of action that will contribute to improving the environment and health. Given a COVID-19 pandemic situation, which has produced profound disruption in all sectors and areas, we remain persistent in action, achieving environmental and health goals in the field, among others, on environmental health and climate, air pollution, energy, and health. As a section, we are in the process of preparing statement, and we conclude it and launch it in the World Public Health Conference in October, which is organized online. We will insist on comprehensive line to the environment health management plans, which would be a systematic approach to estimate the burden of disease and injury to the different environmental pollutions. And we will advocate to put the environmental health protection and evidence-based prevention at the heart of world's and EU COVID-19 recovery process. Thank you. I will stop share.
Thank you so much, Professor Jevtic. Fantastic to hear about the many different things that you're doing to elevate this issue in Serbia and across Europe. And it sounds as though you've been working in a variety of ways to educate and engage health professionals, public health professionals, as well as other health professionals. And I wonder if you could talk about, based on your experience, what kinds of activities or strategies have you found to be most effective for engaging public health professionals? And have you seen any differences between engaging public health professionals and engaging clinical practitioners to first get folks interested and involved in these issues?
I think that it's very important to strengthening coalition between clinicians and public health professionals, not divided, but we used to divide. And I think that it's not a good way to improve our environment. And I think that there is, from my point of view, from my experience, there is no many young students and experts which are interested in this area. And that is our mission, to engage them, to motivate them, to make research and to make changes which will lead to change legislation and mindset of all of us.
Fantastic. Thank you so much. And so you've been speaking in part about engaging those young upcoming professionals from a professorial point of view. Our next speaker is actually a medical student and will speak from a student point of view. But if you could just say one thing about what most captures your students' attention when you introduce these issues.
I have a very positive experience because they're first surprised with the wide list of interesting challenges in public health. But interesting challenges is very serious tasks for their future.
Yeah, yeah. Great. Well, thank you so much for sharing your experience, and I very much look forward to the statement that will be coming out in October. I have a particular soft spot in my heart for public health because my background is public health as well.
Thank you.
Okay, we're now going to move on to our next speaker. Our next presenter will be Kacper Łuszczki. Kacper is a medical student at the Collegium Medicum at Zielona Góra University and a student of biotechnology at the University of Life Sciences in Wrocław. He is also the National Public Health Officer at the International Federation of Medical Students for Poland. IFMSA is one of the world's oldest and largest student-run organizations, representing and connecting every day with an inspiring and engaging network of 1.3 million medical students from 133 national medical student organizations in 123 countries. And this description was prepared for me to introduce IFMSA, but I also say from personal experience, I've worked with a number of IFMSA members. IFMSA sits on the Global Climate and Health Alliance Board of Directors, as does HEAL, and it is always a delight to work with IFMSA members, and they are indeed inspiring and engaging. Kacper is going to talk to us today about the IFMSA Poland climate statement, which was published in June on World Environment Day. Over to you, Kacper.
Hello, can you hear me?
Yes.
Okay, I'm gonna share the screen right now. Okay, can I speak in Polish?
Yes, please go ahead. And just a reminder to those who may have joined a little bit late, if you need translation either into English or into Polish, at the bottom of your screen, there's a translation interpretation button. And if you wish for English, click English. If you wish for Polish, for some reason, click Portuguese. Okay, Kacper, please proceed.
Dobrze. Też, szanowni państwo, miałem opowiedzieć o...
That's right, ladies and gentlemen. I'm supposed to talk about IFMSA Poland. Our organization is quite complicated from the organizational perspective, and you can really get confused when you look at all those abbreviations. So at the beginning, I would like to tell you what our organization is like. IFMSA Poland, which is International Federation of Medical Students Associations, is a non-governmental organization which associates, as it has already been said, 1.3 million medical students from 126 different countries all over the globe. It is a sort of a federation, which means that it is divided into parts which have significant autonomy, but they have one joint board. Our part, which operates in Poland, is called IFMSA Poland. IFMSA Poland has branches in 17 universities with medical faculty. IFMSA is involved in everything which may have influence on the health of our society, and it also supports members of the organization in professional development. It does it by the permanent panels. We have 6 of them, which is SCOPT, which is the Standing Committee on Public Health, which promotes information and prevention actions, and it promotes the interest of the public in public health. SCORA, which is the Standing Committee on Reproductive Health and Rights, It is connected with reproductive health and AIDS, and it promotes education and prevention of the sexual diseases. SCOME, which is medical education, which prepares students for future professional work. It promotes research in medical teaching. SCORP, which is the Standing Committee on Human Rights and Peace, which is involved in human rights and peace. SCORI, which is the Standing Committee on Research Exchanges, which enables the work in different scientific projects at university, and SCOPI, which is a standing committee on professional exchanges, and it is done for clinical internships, which allows for internship to be executed in different hospitals all over the world. All these programs can work locally. It is connected with education action at a school, university, or by the creation of different information campaign online, also by preparing declarations on different subjects. After this introduction, I would like to get back to the beginning of my presentation, what we do in the light of the climate change. This subject is a subject for Skopje. It influences hugely human rights and refugees. SCORP decided to focus on a zero waste program by such actions as peer education, which was developed by Anna Wściślak and Nikola Mikołajczyk for primary schools. 5 R principles were developed: to refuse, reuse, reduce, recycle, and reprod. Students' exchanges of books and clothing, information campaigns on consumption growth, as well as the Zero Waste campaign in your everyday life in cooperation with the Embassy of a Clean Planet. In the future, this program is also going to deal with the subject. However, this year, SCOPE, which is the standing program for public health, I am a member of that program, by the way, is also involved in climate change. We were able to prepare the position concerning the climate change, and Weronika Michalek from Poland was involved in it as a mentor. In our position, we decided to urge the government, local authorities, media, and all stakeholders to act in a very determined way in the light of the climate change, invest in renewable energies, as well as the development of the plans to reduce greenhouse gases. We also urged medical universities to introduce to their curricula information about climate change and its impact on human health, as well as healthcare professionals and medical students were urged to develop their knowledge and educate others to this extent. In this position, we were trying to also discuss this problem in depth, because everyone who is going to read this document should develop their knowledge. We talked about the different groups that were impacted by climate change in a very adverse way. We also talked about extreme weather phenomena, influence of air pollution to health, the development of vector diseases, as well, diseases that are connected with water pollution, migration, and influence on mental health. The development of this position is also connected with the development of advocacy. Every member of our organization can participate in discussions on the subject. On the occasion of the World Environment Day, the 5th of June, our position was adopted. The position was officially endorsed by representatives of all the members of our organization, and then it was sent out to the 3 ministries in Poland, which is Ministry of Health, Ministry of Climate, and Ministry of Environment. On this occasion, the position was described by several portals, for example, Science in Poland, Academic Forum, Prost.pl, Protect Climate, Now the Environment, and Being a Doctor. Later on, in the frameworks of our advocacy actions, we started to develop a cycle of 4 webinars on climate change, and we were able to invite experts to participate in them. So far, we have done such webinars as climate change causes and impact with Professor Zbigniew Karachun and Professor Szymon Malinowski, the position of IFMSA Poland in the light of the climate change and health, the influence of climate change on health, and risk groups with Dr. Piotr Dąbrowiecki and Weronika Michalak. Those were the webinars that have been organized. However, well, on the 16th of September, the last webinar in the cycle is going to take place. And the title is going to be connected with the activity of non-governmental organizations in the light of the climate change. And we will have the representatives of such organizations as Extinction Rebellion Poland, Climate Coalition, and Heal Polska. You can watch all of them on YouTube. As far as the climate change is concerned, we also started to work on our survey. And the survey is to check the opinions and knowledge of medical students in Poland about climate change. This survey will allow us to better argument changes we want to be introduced to the curricula at medical universities. The survey is done under the mentorship of Weronika Michalak and Professor Korachun. I also can tell you that for now, we already have gathered almost 400 responses from medical students from all over Poland. What comes next? We plan to organize a periodic action. We want to do this on a number of occasions. It's going to be peer education at schools, and we want to present the problem to the youngest members of our society. We also intend to organize a greater number of webinars and conferences on the subject. We want to cooperate with other NGOs. And we want to develop information campaigns on Facebook, and we want to do much, much more. And that's it. Thank you very much for your attention.
Thank you so much, Kacper. I'm always impressed and astonished at how active and how much medical students who have a very full plate with their medical studies are able to accomplish. But I wanted to ask you, why are these environmental issues a priority for the medical students around the world who are getting involved in this through IFMSA?
Should I answer in Polish or English?
Whichever you wish.
Okay. We know, as an International Federation of Medical Students, we know how big the impact of global warming has on health. We know that there already has been hundreds of thousands of deaths because of this problem, and we really can't be calm about it. We need to do something about it, and we try to do our best and do what we can. So it's like I said, webinars, conferences, and peer education. And I think this is a big problem we need to address in everyday life, and I hope we can do it justice by our actions.
Was climate change or were other environmental issues a part of, have they been a part of your medical curriculum in your studies?
We, in Poland, there is not really a big impact, or we don't really talk about it in our medical curriculum. So no, I think not.
Mm-hmm.
But I will say I'm a third year medical student, so I can't actually answer for all the medical students.
Yeah. And from the work that you've seen by IFMSA and your own work, what has IFMSA seen in terms of the response from medical school administrations when medical students are elevating this issue or pushing for encouraging for these things to be included in the curriculum? Have you had responses from medical school deans and medical school administration?
Actually, not yet, because it's, as I said, it's a pretty new topic in IFMSA-Poland. So we just started to create a study on this topic, and we would like to, after we get our results, we would like to show it to administrations across the Poland in universities to change it, but we don't know how they will react right now. But we would like to make a change.
Yeah. Well, very best of luck with your work on that. And it sounds like Professor Jevtic may have some tips about how to incorporate things into the curriculum. So that sounds like a potentially good connection there. So thank you so much for your remarks and the work that you're doing even while preparing to become a doctor. So
thank you very much.
Okay, we're now going to move on to our final presenter. We are going to have the opportunity to hear from Dr. Tadeusz Zielonka. I had the privilege of meeting Dr. Zielonka a couple of years ago in Poland when the UN climate negotiations were there. And Dr. Zielonka was part of an event that Global Climate and Health Alliance and the World Health Organization and HEAL and other partners organized alongside the climate negotiations, focusing on climate and health and addressing not only health professionals, but also delegations and cross-sectoral representatives from other sectors. Dr. Zielonka is a specialist in lung diseases and internal medicine and assistant professor at the Department of Family Medicine at the Medical University of Warsaw, as well as a member of the Polish Society of Lung Diseases. He is also the founder of Doctors for Clean Air in Poland, and he will give us his view on health engagement on climate in Poland, especially when it comes to bringing further doctors and additional doctors into the movement. So over to you, Dr. Zielonka.
Witam wszystkich. Muszę powiedzieć, że...
Good afternoon, everyone. I have to tell you that I'm going to present opposite arguments as compared with the arguments presented by the colleagues who spoke before me. Because what I prepared is a subject, is a talk about the subject, why is it so bad if it is so good? And now we have to think about 7 items that I selected. Let us start with what everyone knows perfectly well, that the global warming is a fact, that it leads to very specific changes in our world, and no one has doubts about it. We know perfectly well the root causes of it. We all know what causes the global warming. We have identified also quite well all the health effects of climate change, especially what we are interested in as doctors, vector diseases, well, the diseases transmitted through water, GI diseases, as well as those that are connected with water shortage or extreme weather conditions. But what is very important, and what we believe is very important in Poland in particular, is deaths due to air pollution. And it's directly connected with climate change. The number of those deaths is identified by WHO, 7 million per year, 500,000 in Europe, and 70,000 in Poland. We know how these people die, and we know what the linear dependence is between the concentration of pollutants and the death rate. We also know how diverse the influence of air pollution is, or climate change is, on health. We all know this perfectly well. That is why we should think about it. If our knowledge is so vast, if it is so precise, and it is not new, we've known it for years. So why this is the Polish reality? Tell me, to the left, the top picture is the historical capital of Poland with the seat of the Polish kings, which is diving in smog. cities which are full of low emissions, as well as the growing pollutions from cars or energy-related pollutions. There are some specific features which for Poland, from people from out of Poland should know. Well, our economy is coal-based, like 100% almost. It is unprecedented in Europe. Moreover, since 2003, the quality standards for coal were abolished, and then the coal of very low quality was allowed in the market. It's not even coal, but it's like products resembling coal. But there is another thing which is terrible in Poland. People burn plastic and rubbish, and we are actually a scrapyard of cars that are 20 or 30 years old, and they even have their filters removed. So there is no surprise, and we know this perfectly well, that Poland is, from several perspectives, like, for example, you know, PM 2.5, PM 10, PM 5. From those perspectives, Poland is at the very last place in Europe. In the area of benzoapyrene, it is on the very last position, and the values are extremely high all over the country. Same goes for the vectoral diseases. We can see perfectly well the impact. Those are the facts, and we know them, we describe them, and it is quite well known. And there is a question, who is to blame? And very frequently in the discussion, we hear that it is the politicians that are to be blamed. People say that it's the people who are to be blamed. During the climate summit in Katowice, I said for the first time that largely the slide that I showed to you before, well, for that slide, it is the medical community that is to be blamed, because who is going to tell to the people? Who is going to tell the politicians about health outcomes? If we are to talk about the consequences of air pollution, those consequences are of health nature. As far as climate is concerned, they are much broader, and health is a strong element. But you have to remember that it is medical doctors who should inform the public about it. And there is a question that we have to ask. Showing all those slides, everyone knows perfectly well, where is the medical community? Where is the clinical community in it? Well, the community who should face up to those challenges. Well, how did they respond? It is the ethical duty which is prescribed in the Code of Medical Ethics that environmental threats should be notified to the society. How much do we hear in Poland this very clear, distinct voice of the medical community, the leaders in the medical field who would spend some time to the subject?
I was wondering about the reasons for why that is not happening, and while doing that, I chose two groups of causes. The first one is educational in nature. My colleague started saying that until third year in the medical school, he's never heard of these topics, and that's not going to happen until year 6, because it's not happening in our course of education. Unfortunately, these topics are not treated as priorities. So when it comes to climate change and their influence on health. Also, we are in a country with the highest level of pollution, and yet the education about the effect of pollution on health is marginalized. It's not even included in medical guidelines. So what's very negative in Poland, and it's very also specific to Poland, is giving a priority to repair medicine over prevention, over prophylaxis. So the focus of the system goes to repairing the health that has been damaged by the environment instead of preventing the damage. So we are talking about the entire switch of medicine onto repairing things. It could be said that the medical community basically lives off our damaged climate or our damaged environment. Even if there are certain groups that have enough knowledge on that, they are not using this knowledge in their clinical practice. All that is reinforced with certain systemic problems, because there is understaffing in Polish medicine. We are lacking doctors and nurses in terms of per capita numbers, and this has to be reflected in the education of patients by medical professionals. In practice, this is not happening at all. The majority of financing goes to hospital care, not even outpatient care, but hospital care. So the prevention is really somewhere on the periphery. I conducted research for some years trying to find out about the level of education among healthcare professionals. I've investigated nearly 500 specialists representing top medical universities and various facilities in Poland. I asked them, and then I asked the same questions to patients with pulmonary problems in this case. And when I asked if they have satisfactory knowledge, and I asked that to the doctors, only 20-something percent confirmed that they didn't know enough about the influence of pollution on health. If I asked the patients that, you see what the situation is here. They thought, the majority of them considered their knowledge to be very satisfactory or very advanced. Strangely, the healthcare personnel were not an authority for them, but rather the media, newspapers, internet. To be honest, the doctors also did not quote as an important source of knowledge the medical personnel. When I asked them where they found out about these topics, they listed conferences, medical publications, not the media. But what was truly concerning was the question about WHO standards and the concentration of air pollutants. 30% of patients knew the answer to that question, and much fewer healthcare professionals. When I asked the doctors if they were following concentration of pollutants on an ongoing basis, 16-20% maybe declared that they did. Perhaps cardiologists were more focused on it, but even so, even if the cardiologist did declare that they did follow that information, they were not using this information in their clinical practice. They did not inform their patients about health effects of that, even though they followed the information. You see that over 60% of patients did follow these numbers, so they are more interested in the effect of pollutants on their health than the doctors that should be healing them or curing them. I also checked the knowledge with 3 short closed questions, and it turns out that the number of deaths associated to pollution was better known to patients than the doctors. So only 7% of pneumologists knows that. Even bigger discrepancy is visible when it turns to sources of air pollution in the city where they work. 55% of patients did know where the pollutants came from, but only 30% of doctors. Smog-dependent diseases, patients tended to know more about the diseases caused by smog than their own doctors. So you could really see that disproportion between a declaration and the exact knowledge. Many declared that they know, for instance, about the source of pollution, but it turned out that only half of them actually knew the situation. Among patients, these differences were not as visible. The same goes to the knowledge of diseases caused by pollutants. 90% of doctors say that, yes, I know what diseases smog can cause, and then it turned out that only 40% of them, in fact, did know that. So the patients were better in this case, once again, better than the doctors. So after these 3 questions or 3 answers only, it turned out that 1 to 3% of the specialists knew the answer to all the questions. The same was true of 8% of the patients. But when you considered who gave 3 wrong answers, the lowest percentage was in the patient group. So it seems to show that patients are more interested in the impact of air pollution upon their health. They know more than the doctors who treat them, and that knowledge, even if the healthcare professionals do have it, they do not employ it in their clinical practice. medical education is a key element here, and undoubtedly we should focus on it. However, I considered this topic a little bit more broadly, because this is not the only case of a similar nature. We might think that it's something new, but, you know, London smog, that's back in the 50s. People did not start dying because of air pollution now. It's been going on for 70 years. So we had time to implement it, this topic into medical guidelines. The history of medicine does not show that it's happening so rapidly, unfortunately. Jean Nicot, who gave the name to nicotine, in the 17th century recommended tobacco smoking for health. Doctors, and you can see that in these images from the 19th and 20th century, actually recommended smoking because they said that it was good for your health. In 1949, there is a conference that unequivocally showed and confirmed research proving that there is a correlation between smoking, tobacco smoking, and cancer. In the 50s, the manufacturers also confirmed that research. In the 60s and the 70s, there were abundant research results showing the same, and yet for decades to come, our guidelines, our medical textbooks did not show that very clear information. It was not until the 90s. So 30, 40 years later, the medical community finally introduced that problem into medical guidelines. It was in the 21st century that the governments introduced some regulation. You can see the same in the area of vaccinations. We all know that we should vaccinate against the flu, people above 65 years of age. You've got in some countries over 70% of vaccinated population. We've got less than 4% in Poland. So from knowledge to implementation, there's a long way to go, even if it is included in the guidelines. The causes of lacks of vaccinations are also lies in what the doctors tell the patients. And a very important element that has already been mentioned, and I think we should devote a little bit more attention to it, is the results of lockdown. Kraków completely changed over time. You see what it looked like in the upper row, and then what you see in the bottom. So the streets are completely different. You see NASA images that also show very clearly how the amount of pollutants changed. It was actually calculated how the levels of pollutants changed in the air. It was calculated and it translated into very clear health-related outcomes, lack of or reduced mortality, reduced numbers of medical visits, use of medications, hospitalizations, or work absence because of
2 more
disease.
minutes, please, Dr. Zielonka.
Right, yes. The death rate in Poland dropped by 4,000 in a month. So we know that if we do something, there will be a considerable result for health. What's happening in Poland now? On the media, we hear from the funeral industry that there were fewer deaths because there were fewer planned surgeries and less surgical related deaths, or Polish people were not abusing meds because access to medical professionals was more difficult. So if we hear that information on the media, if our medical professionals are not able, 2 years after the introduction of Kigali Amendment, change their guidelines and use more climate favorable meds, because there are certain asthma-related medications that have a very unfavorable environmental footprint. Many doctors do not know that, and they still prescribe them. We've got 300 million people globally with COPD, many thousands with asthma, or millions with asthma. So annually, that's a huge consumption of these environmentally harmful meds in the world. So we have to really reconsider our education on all its levels. We have to do whatever we to change it, because it's impossible to detract theory from practice. I'm a clinician. I work in a hospital and in an outpatient clinic, and I know that everything we've been talking about here is very far away from what the clinicians do on a daily basis, and this has to change. We have to activate stakeholders, to encourage them to speak with a loud voice and make it clear why we have to change Polish reality. Doctors have to be free from red tape. They have to have time for education. We have to calculate both direct and indirect costs, because this is behind many problems in Poland, why environmental effects on health are very often omitted. And we have to focus more on prevention, because all the problems that we've been talking about, they are medical problems, but medical community is not aware of that, and they think it's just a political issue or an economical issue rather than a health-related issue. Thank you.
Thank you so much, Dr. Zielonka. Very comprehensive and very provocative and challenging presentation. I know that we'll get into more of a discussion about that in the next segment, where we'll sort of open up the discussion to all of the panelists. But there is one specific question that came in, and I recall this question coming in as well when you spoke a couple of years ago. This question was about getting access to your slides. People are always seem to be very, very interested in the results of your surveys and your research. And so a question to you or to the organizers as to whether your presentation and your slides are available.
Ja opracowałem te dane w tej chwili w formie artykułu.
Well, I have that data also in the form of an article. I've got 3 publications, 3 articles that show these results. The first article has already been reviewed. I just need to introduce some small changes. The 2 other ones are completely finalized, finished, and getting ready for issue. So very quickly, the results of my surveys among cardiologists, lung specialists, and so on, it will be published. So we will be able to use it, because what I showed you here, this has already been edited, and so you will have access to it in that form.
That's perfect. That is actually the best possible answer, because that gives it the peer review and that stamp of legitimacy through that kind of peer review process, and means that all of us in the health community can take those findings, which are very striking and very powerful, and use them to make the case for why doctors need to step up their education and their engagement on these issues. Very powerful. So in just a moment, I'm going to open the discussion for a broader discussion with all of the panelists. And I encourage everyone who's attending to post questions that you may have for that discussion in the Q&A. But before we get into that, I just wanted to share a little bit about the work that the Global Climate and Health Alliance has been doing recently. And I was asked to present GCHA's work, but this is really the way I think of it, not GCHA's work as much as the work of the health community globally. Some of you may already know about this. In May of this year, the global health community sent a letter to the leaders of G20 countries demanding a healthy recovery from COVID. And healthy recovery included investing more deeply in health systems and also ensuring clean air, clean water, a stable climate, and an equitable and sustainable future for everyone. That healthy recovery letter was supported by GCHA and the World Health Organization and Every Breath Matters, but it really came out of conversations with medical and health professionals that I work with on a regular basis, some of whom were in fact on the front lines in response to the pandemic. Others were involved in contact tracing and kind of public health responses. And they saw governments in the economic response to the pandemic starting to invest money in ways that reinvested in fossil fuel and carbon intensive industries, and that dialed back on climate action, and that weakened environmental regulation. So they saw some of these things happening in various countries. And these medical professionals and health professionals that were active on the pandemic said, that's not acceptable. We're here fighting a health crisis, and yet countries may make decisions that make future health crises even worse. So this letter came out of that engagement with health professionals. It was signed on by organizations representing over 40 million health professionals from around the world and delivered to G20 leaders in May. And we've since learned from some of our diplomatic contacts that it actually resonated and reached those leaders, that about 2/3 of the G20 countries whose leaders received this letter responded and took that to heart. So they heard the voice of health professionals. And I think that's particularly, I've been doing this work of engaging and working with the health community, my community, for many years now, and have always known that health professionals are among the most trusted voices in any society. I think that has only dramatically increased during this pandemic. So health professionals are on the front lines, putting, in some cases, their lives at risk to care for people. And so our voices, particularly your voices who are very active in that space, are very influential. The other thing that I think is really important that I've seen in country after country is that health sector involvement on these issues has the capacity to depoliticize them. What do I mean by that? In some countries, my own, the United States, climate change is a very politicized issue. It's a right wing versus left wing issue. And if you're on one side, you believe in climate change as if it's up for belief, and on the other side, you don't. From the health community, we can bring the perspective that this is not about right or left or political party, but rather simply a matter of health. And we're able to do that, I think, for two very powerful reasons. One is the health community is trained I was just muted. The health community is evidence-based. We're trained in the evidence, and I think that's part of why your slides are so powerful, because the health community responds to the evidence base. And on the other hand, we have stories to tell about the impact on real people and real communities.
Oops, you're muted again, Jenny. I don't know why. Okay, sorry, go ahead.
Yeah. So that combination of being evidence-based and yet having that real connection with people, with families, with patients, with communities that we as health professionals serve and care for is a very powerful combination. So with those things in mind, I'd like to open a discussion to all of our panelists and start with the question, which is kind of the focus of this event. How can we increase the level of awareness of Polish health professionals about these issues, and not only their awareness, but their engagement? So our panelists are all people who have been working to engage your peers and engage the sector. what can we do, what can be done in Poland to increase the engagement of health professionals? I might turn to you, Dr. Zielonka, since you raised this in such a provocative way. You laid out the problem, some of the challenges. What do you think, and some of the solutions, what do you think is the most important next step in addressing this issue in Poland, engaging the health community?
Niestety to zajmie lata, dekady.
Unfortunately, that's going to take years or even decades. This is not a problem with some sort of a quick fix because we don't have educators. And I think this is mostly, the education is performed by educators from outside of medicine. If I turn the TV on and I want to listen about the influence of climate on health, about health changes, I listen to engineers, or I hear environmental engineers, environmentalists. There are very few medical experts who do speak to that topic. And this is a very difficult situation because now we basically don't have educators. And this is a very serious problem because without staff, without personnel, you can't teach others. I said we need education, but who's going to do that if we don't have educated medical staff? So, well, unfortunately, this is also a systemic problem, because if you send all the money for repair rather than prevention, then people learn repair medicine, restorative medicine, because this is what is being paid for. I do value everyone who focus on prevention, who focus on public health. I think this is a priority for medicine, but I'm a clinician and I do see what my colleagues are doing, and they do focus on what they were told to do, that you're supposed to treat, diagnose and treat. So there is no understanding of the problem in Poland. Let me put it this way. It's like I said, that doctors are not educating patients. I did say that. But at the same time, the understaffing means that we need 20 years in Poland to rebuild our medical personnel, to return to the numbers from communist Poland, so that we have the same number of doctors per capita than we did have in the previous system. We need 20 to 25 years for that. So, what's the problem? Double the number of medical students. Once again, we don't have anyone to educate these students. And this is not something that we can just change overnight, because we don't have double the number of educators. And not even that, the experienced specialists in Poland are typically right before they retire. They are nearly retirees. So in 5 years, the true crisis is going to happen, because we will have young doctors who have been trained by very young doctors. So these are systemic problems, systemic flaws. I showed you, and it's no accident that Poland is the most polluted country in Europe. Our GDP is 6th in Europe, but we are very high in terms of pollution. So this is completely not connected with our financial standing, with our financial status. Research shows that in Poland, as compared to the level of development of the country, the increase of GDP is not associated with the decrease in the level of pollution as it used to be in other countries of Europe. Because in Poland, even though GDP is rising, the pollution is also rising. This is not normal. This is not normal phenomenon. That's why I showed you that the damage that was done to medical personnel, people are not aware of that. Most of them in Poland, in Europe, they don't know that we have 3 times less doctors per capita than the Western countries. But it's even worse than that, because in the number that we do have, 1/3 are those who should already retire. They are sometimes 80s or 90s, and they are still actively working. They are included in these statistics. So it's not even 3 times less, it's 5 times less in truth. And as a country, this is not something we can cure overnight. We need 20 years at least. You all say that, you know, doctors should tell that to the society. Yes, that's true, but we don't have enough doctors, and we don't have anyone to teach the new doctors. And this is a very serious problem, because it's not correlated with the affluence of our country. So I'm sure, I'm really sorry for being a pessimist, but I'm a realist. I see what's happening in the community where I work. I work as a clinician.
Thanks. I mean, those are hard truths and deep systemic issues. And you're quite right. These are not things that are solved easily and quickly and by just raising awareness. There's substantial work over many years, as you say, that is going to be required. I want to turn now back to Kacper, because you are embarked on the work of engaging your peers to demand some of this education and or gathering the data to justify the need for this kind of training. I'd like to ask you what you see in this picture and what you would like to see in the medical curriculum, and how you foresee the kind of student voice helping to shift that dynamic so that these issues do begin to be included. So over to you, Kacper. And you are currently on mute.
Yes, thank you. I would just want to say that we are trying our best, and IFMSA-Poland has a committee on medical education, and as students we have a way to tell our Ministry of Health what kind of changes we would like to see in a medical curriculum. And when we have the voices of every student in our Poland, we can show the ministry that we want these changes, we need them, and we would like to see them now. And so we have a way to voice our wants to change, but we need to make our peers more open to this idea and more open to advocacy. And this way, we would like to make a lot of webinars and conferences and educate on this topic more, like Mr. Dr. Zielonka said, we need educators on this topic. We can't do much without them, and we need to advocate for changes right now. And everyone who created our statements on this topic, we are trying our best to make our peers more open to this idea. Sorry, this is a hard question because we really try to make our peers care more about the environment and global warming by creating a lot of I'm sorry, I have to change to Polish because it's...
Please do.
Dobrze.
Nie ma problemu. All right. We really want to create different trainings, webinars, conferences, workshops on the subject. And we do hope to invite a number of experts in the area. Just as Dr. Zielonka said, the absence of educators is really a problem. And we believe that thanks to the trainings and webinars, we will be able to develop those experts, stakeholders, educators, people who will go out and say loud and clear that we want the change. They will also go to the ministry and they will speak for the change. Currently, we are involved in the survey I told you about. We already have collected 400 responses. And from what we can see from these responses, there are so many students who want to see the change and they want the change to take place now. We plan, well, we do hope to introduce the changes in the curriculum and the syllabus of the subject of public health. Now, this issue is not really very seriously taken. But it can become one of the more important subjects taught at university, at the Faculty of Medicine. As Dr. Zielonka mentioned in his presentation, it is part of our ethics. It is our professional ethics. And the Code of Ethics says that we have to educate the people. We believe that the public health will be able to actually convince students of medicine to educate the public better as medical students later on. So I hope that I have answered the question properly. Sorry for the confusion with the languages.
That is no problem, and you have my respect for being so articulate in your second language. I speak Spanish as well, and I'm not nearly as articulate as that, so no problem there. I want to now direct a question to Professor Jevtic. So given some of the challenges that have been laid out, what role do you see for working within professional associations and professional societies to help move these issues? And I think elevating, you don't necessarily need to respond directly to this, but I want to elevate the challenge that the Polish health sector needs much more deep investment, reinvestment, to kind of be rebuilt. So there are a number of challenges on the table. What do you see as kind of the opportunities working through both national and regional or international health professional associations?
As I mentioned, that educational process is very important, but not only educational process. I totally agree with my Polish colleague that it's most important for health sector is human resources. Strengthening human resources in public health, it's also important part for Serbia, for example, for Polish and for all the other countries. It's very important. And in our associations of doctors, we should strengthen this in this way, how we can improve situation with human resources and different kinds of specialization, changing in curricula in medical faculty, but also in during the specialization, because environmental issues is not enough in the focus of health professionals. So sometimes I I could better understand in communication with other experts, urban plannings or engineers or architects as a public health professionals than with my colleague clinicians.
Mm-hmm.
So we can move and work together. This is very important. And also clinicians is not enough aware that we are the part of health sector is a big part of also we make some pollution.
Yeah. Yeah.
Waste management with not enough clean energy, etc. They're not aware about it.
Mm-hmm.
Very big issue also.
Yes, indeed.
So there is a lot of topics, but I think that I'm very glad that some students are interested in topic. And climate change is not only climate, environmental climate, it's also mental climate change. We have to change mindset. And the COVID situation, COVID pandemic should be our opportunity and challenge and the win-win process, not to be just stop for environmental issues.
Yeah, thank you. That's an excellent point. You know, the pandemic has really had very serious impacts, but also kind of opened up an opportunity if we're able to seize it, because everything is different right now. And so it creates that kind of opportunity for change, again, if we're able to seize it. So there's a question that was asked by one of the attendees that I'm going to ask. And then also our speaker who was not able to join us as a speaker, I believe is on. So while I ask this question and see if there are anybody who would like to take it up, then I'll ask the kind of technical team if we're able to allow him to jump in for a comment, Professor Kizanowski, if we can allow him to make a comment. But in the meantime, while the technical team is figuring that out, one of the listeners asked the question, although the topic of the conference included environmental health, part of the One Health approach, the speakers did not mention One Health education or One Health. What do they want to say on this subject? And for our speakers who may not know, One Health is an approach that looks at both human health and animal health together, and the intersection between those two. And that's certainly an issue that is relevant to COVID, but also has bearing on things like our food systems and how we interact with the animals and the livestock in our world. So to our speakers, do any of you have thoughts on One Health as part of the way we talk about these issues, and particularly in Poland, does it have any kind of potential to be a way to frame these issues?
Ja uważam, proszę Państwa, że to jest...
Well, I believe, ladies and gentlemen, that it is just exactly the same problem all over again. I do agree what Professor Jevtic is doing. However, this should be strengthened from the systemic perspective, because I continue to believe that it is not enough that we have so ambitious plans that someone knows how to execute it, but the system support must be provided. Unfortunately, well, it is very important here to focus on interdisciplinary nature, because if the state does not understand that prevention is better than repair, that if the state does not stop subsidizing it, it will be bad. Well, I believe that it is connected not only with the problem of education. The problem of education can be solved. It is just a question of time. However, we are not going to start to solve this problem until you develop some system-based solutions, which unfortunately are missing from a number of countries. There are some countries which do not take into account indirect cost. If they do not take into account indirect cost, then they do not understand the notion of prevention, and this must change. In many countries that have good health indicators, well, those indicators have been achieved thanks to that approach. And so I believe that when we refer it to some solutions, what can help Poland is a strong international cooperation. Well, the presentation of effective solutions, good solutions, which give good outcomes, because it is incredibly important. Please believe me. I remember when people were fighting in the world of medicine after the Montreal Protocol, when we were saying, well, we need the medicines. The world will collapse without inhalers. And see what happened? We eliminated Freon. And the ozone layer is being restored. It is a very good outcome how international efforts were able to give us a very positive impact. And we can see that medicine was forced to change, and the change is a change for better. Well, the medicines introduced by pharmaceutical industry under the influence of the Montreal Protocol turned out to be even more efficient and better. And it is so because the industry was forced to do so by the Montreal Protocol. Why am I talking about it? Because it's been 2 years since the Kigali Amendment was introduced, and please believe me that Polish doctors do not even know that there is the Kigali Amendment. They have no idea that there is green treatment of the POPC, and they have no idea that it is possible to adopt the asthma-friendly drug for an asthma patient. The British have done this. The British Thoracic Society has proposed the movement to green treatment of pulmonary diseases. And in Polish societies, the problem has not been noticed, although this is a binding law. Poland signed it. The medical society in Poland doesn't even realize that there is the Kigali Amendment binding in terms of the COPD, interdisciplinary and greater international cooperation.
Yeah, so yeah, Professor Jevtic, and then from there we'll go to Professor Kizanowski.
Just a small reflection. I already mentioned legislation, not only education, but legislation and not to make some new legislative documents, but respect all documents and all legislation. And when we talk about human resources, we have to mention mobility. That is the natural process moving people and the young experts. And that is the problem of some countries like our country, Croatia, Poland, etc. So just to put it, thank you.
Yeah. Now let's turn to Professor Kizanowski. You were going to be one of our panelists and ran into issues that made that not possible, but we would love to hear your comment at this point. Professor Kizanowski, you're on mute.
Okay. Now I got the permission to unmute myself. So thank you very much for the invitation to speak. And my apologies for not being one of the presenters, but I think those presentations before, and the discussion have been extremely interesting and enlightening. And I want to talk mostly about the human resources which are very much related to organizational and institutional capacities in countries like Poland, but also most of the, let's call the central and eastern part of Europe, which has been depleted from the old structures of sanitary or public health services to some extent due to political reasons, I think, because they had connections to old system, which was like a Soviet system of public health focused on prevention and on hygiene and prevention on communicable disease. And as a, I would say, joke of history, we have now the pandemics of COVID, and in countries like Poland, that was the first time in many years when I have heard people and journalists and policymakers pronouncing more or less properly the word epidemiologist. Epidemiologists have not existed in Polish language almost, and now suddenly epidemiologists are on camera on main TV channels every day. This is unfortunately an opportunity for public health and epidemiology to come forward. Also in the world of environmental health. And here is the call to Kacper and to his colleagues, to the new generation of medical professionalists. Please do remember that this part of medicine, public health, exists. And I recall a statement from very long ago. I mean, many of you have not been working and certainly sometimes not living here, but there was a Polish epidemiologist and leader in public health, Professor Jan Kostrzewski, who was a very good epidemiologist, and he was also a Minister of Health at some point in time due to the smallpox eradication activities in the 60s. And he was convincing several clinicians to turn, or young clinicians in the beginning of their career, to turn to public health and to turn to public to epidemiology, or also of non-communicable disease epidemiology, arguing that as epidemiologists and public health workers are able to save lives of thousands or millions of people at a time, and not individual patients. So that was convincing to a number of people who learned epidemiology and public health abroad at that time. The possibility, due to personal contacts of Professor Kostrzewski, those possibilities were made, and several of those people were working at the end to a large extent in WHO, in World Health Organization throughout the world, serving global population and not necessarily in Poland. But the point is to young adepts of medicine is that they should use current modern possibilities and opportunities of learning and be probably much better than current educators, which, as Tadeusz Zielonka says, will be soon pensioners, as I am, and use remote education capacities and possibilities. It's fantastic now. I mean, the COVID again taught us that a lot of teaching can be done remotely. You don't have to go to the best universities to get lectures and discussions from the best universities professors. It's not the same as having a tutor in your own university and having discussions with him one-to-one every day, or as practice says, well, every quarter of a year. But it is something when you can profit. And one of the examples is the recent International Society for Environmental Epidemiology conference, which is available remotely online for people to follow a very, very rich agenda. But there are also lectures and webinars as this one, which can be used to start up. And the last point from the discussion, well, and in this respect, here I don't know if Veronika will tell about Polish Hill activity. Polish Hill convened a group of people, volunteers, who prepare a statement from representatives, not real representatives, but members of the health sector professionals, statement to policymakers and the society about health effects of climate change and the need to protect it. So the work is going on, and we hope to have it ready in a couple of weeks to show that yeah, there are medical professionals in Poland who take care of climate change and environment and their health effects. And the last point about sustainability of health system, this is extremely important aspect. Tadeusz mentioned one point, the sustainability or effects of drugs, of medicines on environment. But there is much more, I mean, in health sector, which can be made to protect the environment, to increase energy efficiency, to use materials, which less plastics in hospitals and medical care. The list is very long, and unfortunately, it's not really on the agenda of the medical services, which are preoccupied with everyday survival of patients and survival of services. So thank you very much.
Jeni, you're on mute.
Thank you so much for those comments and for being able to join us in the end. Let me just throw into the mix a comment that one of the listeners posted. I think we should cooperate with experts from various fields, create a fora, expert groups consisting of many experts, and share knowledge. Why should a clinician be an expert in environmental pollution? So yeah, very interesting perspective as well. So now I'm going to ask each speaker to give a very brief, just 1 minute final word, final comment, and then I'll turn back to Anne and Heel to wrap us up. So Dr. Zielonka, one minute, brief final comment. You are on mute right now.
O, właśnie, próbowałem go włączyć, ale nie tym przyciskiem.
Excellent. I was trying to switch it on, but I was using the wrong button. Let me tell you the following. We have approached the problem we've been tackling with in a very comprehensive way. There is no one solution only. There is no one problem, one issue or one solution to solve all the problems. We have to really act in a comprehensive way, and we have to engage everyone, and it's starting with patients to doctors, from environmentalists to politicians, from journalists to teachers. I keep repeating all the time that there is a job for everyone to do in the area of climate change, we have to raise people's awareness that it is the responsibility of us all, that it is not someone else's task. We have our tasks here. We medical professionals, whose representative I am, we have our job, but everyone else in the society also have some tasks in this area to perform, and there is not a single person who is not co-responsible for pollution and climate change. It is a task for everyone.
Fantastic. Yes, a good, very good closing thought. We all have responsibility here. Professor Jevtic, 1 minute closing thought.
Yes, we as a health professionals, we have to insist on interdisciplinary and multidisciplinary approach and cooperation with other health professionals, not only in public health, but clinicians and other experts in different fields of interest regarding climate change. We need young people because the planet is there. And we should make leapfrog in making some changing in our curricula, medical curricula, as a health professionals. That is
excellent, excellent thoughts. Future Dr. Łuszczki, your closing thought. You're on mute. Kacper? Ah, there we go.
Yes. Ja chciałbym powiedzieć, że jako studenci medycyny, czy jako...
I would like to tell you that as medical students, as the next generation, we also feel that we are co-responsible for the education of the people, education of our colleagues, our friends. We hope to develop cooperation with organizations that deal with climate change professionally. Because when we were preparing our survey, and we already have 400 answers, as I told you, our students are very much willing to be active. All they need is someone to cooperate with them as a professional, people who really know this area better than we do. We hope that we will be able to develop new educators who will be active in this subject. And I do hope that we who created this environment or this community, we will be the first generation of medical professionals who will be able to deal with the subject in a very professional way, cooperating with other stakeholders, different organizations that are involved in the subject, like Heal Poland or the Climate Coalition or others. Thank you.
Fantastic. Wonderful to close with that kind of look towards the future. So thank you everyone for participating today. I'm now going to turn back to Ann Stolfer at Heal, who I believe has announcements about future events of this type. And back to you.
Indeed. Thank you very much, Jeni. We heard a lot today about the need to further educate and raise the awareness, and that's part of the mission and what is ingrained in what Heal is doing. And actually, the webinar today is part of a series that we're organizing on climate and health in Poland. And I can only underline what was said about the opportunities of switching to online, and actually how COVID has propelled us all to switch to these exchanges, because originally this was planned as a conference in Poland, and I don't think we would have seen the same kind of cross-border engagement that we have seen, with having organizing an in-person meetings. I think that's a very, a good development. I also wanted to share briefly an encouraging example from our work. If you want to try to overcome these barriers on getting clinicians or medical professionals more active, and that is a couple of years ago we worked with the German Medical Association and also with the Specialized Disease Association to bring together a training manual on energy and health, and we got this certified by one of the state medical agencies. policies. So doctors could actually do this manual. They had to answer a couple of questions, and then they got credit for this. So it was part of their continuing education. And it was, we found a very promising opportunity to continue to use the tool and to continue to contribute to raising awareness. And now I would like to move to my thanks, and let me just share my screen briefly. And first of all, thank our wonderful panelists for your rich presentations, for all the food for thought that you've given us today. And I think many things that we can take up in our further work, not only in Poland, but in the European region, and then also globally in collaboration with Jeni and other GCHA members. I wanted to thank the participants as well for your engagement, for asking all your questions, for being here today. And I would give a special thanks to our wonderful moderator, Jeni Miller. You've really been done a fantastic job in steering us through this conversation here today and bringing out all these questions and that we have to continue thinking about. I would also like to thank our translators, Anna and Magda, for your job. Thank you very much. We couldn't do it without you. It's so great that we have you here and we can have this, inter-language exchange here. And invite you all to take part in the next webinar, which will take place next Tuesday at the same time, where we'll be talking about the role of cities for climate and health protection. And we have guests from local authorities from Poland, but we also hear from good practice from what cities are doing in the Netherlands on climate change and health, and then thinking about the future. How can we really achieve the healthy city of tomorrow, which is also, if you want, a climate-friendly and climate-proofed city. So thank you all very much for today, and looking forward to seeing you in one of the next webinars. Have a good evening.